Millions of Americans over 60 swallow a blood pressure pill every morning without ever asking, "Is this the right medicine for my body?" Here's the uncomfortable truth. Those swollen ankles, that cough that won't quit, the dizziness when you stand, even quiet damage building in your kidneys. It could be the very pill meant to protect you. Is the best blood pressure medicine secretly the wrong one for you? Today, we're revealing how doctors really choose between amlodipine, Losartan, and Lisinopril, America's three most prescribed BP drugs, and which seniors should think twice before taking each one. Arteries stiffen after 60? That's normal. But none is universally safest. It depends on your medical history. You'll learn how each works, hidden risks after 60, and which conditions make one dangerously wrong for you. Stay to the end. As we age, arteries lose elasticity and grow stiffer, forcing your heart to work harder, exactly why blood pressure climbs after 60. Left unmanaged, it raises the risk of stroke, heart attack, kidney disease, heart failure, even dementia. But controlling it properly matters more than just chasing a lower number. Common drivers include salt sensitivity, weight gain, diabetes, kidney disease, inactivity, and genetics. In older adults, medication choice matters even more than in younger patients. Let's start with amlodipine, a calcium channel blocker. It works by relaxing the muscles in your blood vessel walls, allowing blood to flow more easily and lowering the pressure pushing against them. It's commonly prescribed in seniors because it delivers strong, reliable BP reduction, lasts a long time in the body, and only needs to be taken once a day. It's especially effective for isolated systolic hypertension, the pattern most common after 60. Common side effects include swollen ankles, facial flushing, headaches, and mild dizziness. Amlodipine tends to benefit seniors with straightforward high blood pressure and no major kidney or heart failure complications. Next up is Losartan, an ARB angiotensin receptor blocker. It works by blocking angiotensin II, a hormone that normally narrows blood vessels, allowing them to relax and lowering the pressure inside them. Losartan offers real kidney protection, making it especially helpful for people managing diabetes, along with meaningful heart protection too. One big advantage: it causes far less coughing than ACE inhibitors, which is exactly why so many patients end up switched to Losartan after developing that persistent, annoying cough. Common side effects include dizziness and elevated potassium levels, so regular kidney function monitoring matters while taking it long-term. Then there's Lisinopril, an ACE inhibitor. It works by blocking the enzyme that produces angiotensin II, relaxing blood vessels and lowering pressure. Lisinopril offers real heart protection, and it's often prescribed after a heart attack to help the heart heal and function more efficiently. It also slows kidney damage in people with diabetes, making it a common first choice for that combination. But it has a well-known downside: a persistent, dry cough that affects a meaningful number of patients, sometimes enough to require switching medications. It can also raise potassium levels and, in rare cases, cause a serious swelling reaction called angioedema. Because of these risks, doctors regularly monitor kidney function and blood tests throughout treatment. Now, let's put all three side by side, because seeing them compared directly makes the differences click. In terms of raw blood pressure lowering power, all three are genuinely effective when dosed properly. This isn't a contest of strength, it's a contest of fit. Amlodipine tends to act relatively quickly and provides smooth, steady, long-lasting control across 24 hours. Part of why it's so popular for once-daily dosing. Losartan and Lisinopril both work more gradually, often taking weeks to reach full effect, but offer benefits well beyond just numbers on a cuff. When it comes to swelling, amlodipine is the clear standout. Swollen ankles are its most recognized side effect, caused by fluid shifting in blood vessels rather than kidneys retaining water. Losartan and Lisinopril rarely cause this kind of swelling. On the flip side, cough is almost exclusively a Lisinopril issue, tied to how ACE inhibitors affect certain compounds in the lungs. Losartan was actually developed partly to avoid this exact problem, and amlodipine doesn't cause it either. For kidney protection, Losartan and Lisinopril both outperform amlodipine significantly, especially in diabetic patients since both block the same hormone pathway that damages kidney blood vessels over time. For heart protection, Lisinopril has strong evidence following a heart attack, while Losartan offers meaningful heart benefits too. especially for heart failure patients who can't tolerate ACE inhibitors. As for medication interactions, amlodipine generally has fewer interactions with other BP drugs, while losartan and lisinopril require more caution when combined with potassium supplements or certain diuretics. And here's something important: many seniors don't end up on just one of these. It's extremely common for doctors to combine two, often amlodipine with either losartan or lisinopril, since pairing different mechanisms often controls blood pressure more effectively than maxing out a single medication. So which one actually fits which senior? Someone already dealing with swollen legs may do better avoiding amlodipine, since it can worsen that exact symptom. Seniors with diabetes or kidney disease typically benefit most from losartan or lisinopril, thanks to their kidney protective effects. After a heart attack, lisinopril is often the preferred choice, while heart failure patients frequently do well on losartan, especially if ACE inhibitors aren't tolerated. Anyone dealing with a chronic, nagging cough is usually steered away from lisinopril and toward losartan instead. Interestingly, some research suggests losartan may even support bone density, making it worth discussing for seniors with osteoporosis. And for seniors juggling multiple medications, amlodipine's simpler interaction profile can sometimes make it the safer, less complicated choice. This is exactly why doctors personalize treatment. There's no single best medication, only the one that fits your specific body and health history. Comment your age, which of these medications you're currently taking, and your country. And subscribe. Upcoming videos will break down more medications commonly prescribed after 60 and how to spot the side effects that actually matter. Here's what worries doctors most: the side effects seniors quietly live with instead of reporting. Swollen ankles get blamed on standing too long. A chronic dry cough gets written off as allergies or getting older. Low blood pressure, frequent falls, dizziness when standing up, unexplained fatigue, and muscle weakness all get chalked up to just aging. High potassium often shows no obvious symptoms at all until it becomes serious, and gradual kidney function changes can go completely unnoticed without regular blood work. Here's the important part, though. If you're experiencing any of these, this is not the moment to stop your medication on your own. That can be genuinely dangerous. Instead, this is exactly the kind of thing that deserves a phone call to your doctor and a proper medical review, so your treatment can be adjusted safely if needed. Let's talk about the mistakes that trip up even careful patients. Skipping doses because your blood pressure feels normal undoes weeks of steady control. Doubling up after one high reading can be just as risky, sometimes causing a dangerous drop instead. Stopping medication abruptly without your doctor's guidance can trigger a rebound spike. Taking NSAID pain relievers like ibuprofen frequently without discussing it with your doctor can quietly interact with these medications and strain your kidneys. Ignoring dehydration during illness makes side effects worse, and skipping home monitoring or routine kidney and electrolyte tests means problems can build for months before anyone notices. Here's something worth remembering. Even the right medication works better with the right lifestyle behind it. A DASH-style eating pattern, rich in vegetables, fruits, and whole grains, naturally supports lower blood pressure. Reducing sodium makes a real difference too, often more than people expect. Regular walking, maintaining a healthy weight, and getting better quality sleep all work alongside your medication rather than against it. Limiting alcohol and managing stress matter just as much. And staying properly hydrated, when appropriate for your condition, helps everything function smoothly. None of this replaces your prescription, but it can make that prescription work significantly better. Ever experienced ankle swelling, a dry cough, or dizziness from your BP medicine? And which one are you taking now? Drop it in the comments. Subscribe for more senior health comparisons like this. Let's boil this down like a doctor would. Amlodipine's strength is steady, once daily control with few drug interactions. Its drawback is that swollen ankle side effect some patients can't tolerate. Losartan's strength is kidney and heart protection with minimal cough risk. Its drawback is a slower onset and the need to monitor potassium. Lisinopril offers strong, proven heart attack protection, but that persistent dry cough is its most common deal breaker. All three are considered safe when properly monitored. Doctors switch medications when side effects outweigh benefits, or conditions shift over time. And when one medication isn't enough, combination therapy becomes common. There's no universal winner. The right choice comes back to your complete medical history. So here's the real lesson to take away. Choosing the safest blood pressure medicine after 60 isn't just about the number on your reading. It's about your entire health picture, your kidneys, your heart, and everything in between. If this helped, subscribe for more senior health guides like this one. Drop a comment with your age, your country, and the medication you're currently on. And please, share this with a family member or friend over 60 who takes blood pressure medicine. It might genuinely help them ask better questions at their next appointment. Coming up next, we're tackling the biggest blood pressure medication myths seniors should never believe. See you there.